My name is Joel Gitari. Now, as we talk about these things, Honorable Chair, we would like amendment done to the bill, Section 14 of the bill, asking that we bring all these products together and ban them the way it is happening in other countries. Yeah, these countries include Uganda, Rwanda, Ethiopia, and others. And even in the developed world where these products have been really in use, they are changing their mind, they are doing things differently. Go to the US, which has been cited here, go to Britain. We read these things a lot, and they are changing their minds. They have discovered that these are very bad things that are not supposed to be used by human beings, and therefore, they are restricting them heavily or even banning them. Countries like New Zealand, to Netherlands, they are doing things the right way. And therefore, we shouldn't allow ourselves to be the ones doing what others are discarding. We must move with the rest of the world so that we safeguard the lives of our children, because we don't have to run away from the risks of tobacco smoke just to land into the risk of vaping, that you replace one disease with another, thinking that now you are solving a problem. So research is revealing a lot more than we have had in the past, and therefore those coming with the figures, they come with the figures, but then we have got a lot and we can all have access to that information. So we would like to look at public health and reduce the disease burden that is really eating into our economy. So that is what we really propose about that. And we are also asking that if it is possible, honorable members, because you are our leaders, that if it is possible, we do away with the designated smoking areas that are hazardous to our environment and the health of the people of Kenya. Those things are very bad. If we can do away with them, that will really help us. And then, honorable members, as we do this, we also look at the Tobacco Control Fund. There is a lot of money coming from the industry, and we are happy that you people are bringing in money. The problem is we don't know how much, where it is going and what it is doing. So please try to find answers to that for us, and then restructure the Tobacco Control Board so that it serves the interests of this country. Otherwise, I don't think I'll go further than that, but our prayer remains that these products be banned for the good of our children, because they attract children into addiction. The major thing is that these are traps that are being used to bring children, young people into the world of addiction. Then they even graduate into the use of hard drugs.
Yes, Honorable Chair, my name is Thomas Lindy. I'm from the same organization. I think I wanted to draw the committee to the Framework Convention on Tobacco Control, FCTC, Article 543, which actually talks about not allowing the tobacco industry in these processes for the sake of public health. The tobacco industry should not be given preferential treatment. In fact, the voice of the tobacco industry should not be heard in such matters that are public health. And in that, that is Section 7 of the FCTC. And finally, Chairman has talked about banning the tobacco product. I would like to add that even flavors that are being brought in some of these products, the United States has been struggling with the flavoring, which is actually hiding the effects of this product. We have menthol, we have berry, and so on. This is not what they are selling. They are selling poison to our children, and our children are getting addicted. So, as parents, And as stakeholders, we need to be alive to this fact. Let's not allow the tobacco industry to take charge of this process. We should not even listen to them. This is a public health issue. Let us move forward without their comment. Thank you, Chair.
Today, let me speak on behalf of persons who use drugs. And I concur with my comrade here. Actually, the tobacco industry should not be given a voice. It should not even be seen. It's a chemical that's killing us. I'm lucky to be standing in front of you. I struggled for 28 years. I was lucky to be alive, but my husband died. We are online. You can search for Olo Aringo. You will get our story. I'm here to point on section 17 and 18, clause 7, 14G, talking about flavor. Actually, many people do not understand the danger we are putting our children in. I simply tried my best to prevent. And Nakada has already shown that young children at the age of 4-7 are already using these tobacco products. And when we bring in flavor, it brings in all kind of illicit products, illegal products, to the point that they entice these children thinking they are buying, for example, what can you say, mint, or they are buying orange. So if I'm to amend, I'll amend that part of flavor because it comes in with color and the scent. Nobody has used cigarettes or any tobacco product. I have struggled with it. So when you see somebody using these products and then they have that scent, somebody will think they're using a perfume or something enticing and he'll be attracted. So let us, dear Chair, ban this flavor, if possible even the tobacco products in the country. Thank you.
And I agree with my colleagues that we should have a comprehensive ban on flavors and we should just follow what our neighbors are doing because we intend on upholding public health more than economic benefits and seemingly profits to the country. We have other sectors that are more profitable to Kenya. So we agree with the comprehensive ban on these emerging tobacco products.
My name is Benjamin Odhiambo. I work with Students Campaign Against Drugs. We run interventions in schools and communities. 3 months ago, a 9-year-old girl asked us, what is likely to happen to my unborn brother because my mother smokes? And she has had the understanding through the interventions that we run that tobacco use in whatever form is harmful. And beyond banning as being proposed, one specific recommendation that we're making within section 20, that talks about licensing, is to appreciate that tobacco and alcohol are equally harmful to the health and well-being of young people. Within the counties, there is already framework to regulate alcohol through different licenses, and counties have structures through which they do that. In that regard, therefore, our key proposal in this area is that we ban licensing for sale of tobacco products with licensing of sale for alcohol products in a way that tobacco products can only be sold in premises licensed to sell alcohol and nowhere else.
Very much, Chair and honorable committee members. My name is Celine Awor. I am CEO at the International Institute for Legislative Affairs, or ILA, and we are grateful for this opportunity. I have I'll highlight just a few of our comments. We submitted comprehensive comments in our written memorandum. So first, we'd like to have the definitions expanded, especially for tobacco products, to be able to include these emerging products, particularly when you look at e-cigarettes, the proposed definition should be expanded to include electronic nicotine delivery systems and electronic non-nicotine delivery systems. Also, we need to consider including a new definition on tobacco devices. This would particularly be to capture the heated tobacco products, because they are traditional tobacco products, but increasingly they are having inserts that are not just tobacco. So you can have infusions, and so if you have that definition, then we expand the ambit of this law to go to regulate those products as well. Then I'd also like to speak about the institutional framework. There is need to strengthen the framework, so what we have with the board and all that, to align it with the Mwongozo protocol. I think we leave that in terms of the membership of that charity structure. I think the guidelines in the Mwongozo protocol provide that. Then I'd like to speak to clause 6, which is proposing to amend section 12 of the current act. This is on tax. And our submission is that the proposed section be collapsed into just one section that then will reflect the fact that we provide kind of uniform tax for all tobacco products. We do not need to have distinct taxes on electronic cigarettes or the new products. Secondly, we would like to have that tax measures be captured in a way that they are progressively reviewed in line with the changing aspects in the economy. For instance, growth in GDP and income, so that we have the taxes realize those changes that we're seeing in the economy. Then I'd like to speak specifically to clause 14J, and we are putting the last bullet on that section, and we are proposing that the definition, that the section we delete it and just retain any characterizing, any flavors or additives, so that it is wide enough to ensure that all flavors are captured. I'll go back slightly to 14A, and in 14A we'd like to reject and that section and replace it with just one statement that no person shall be allowed to either place in the market or for sale the use of single-use or disposable cartridges for either electronic nicotine delivery systems or electronic nicotine delivery system. This is important because when we have the single-use or disposable products, they are one, increasing initiation of young people, and number two, they are just perpetuating addiction in use of these products. So these ones should be completely banned. The disposable and single-use either ends with one end and ends with two ends. Then we accept inclusion of 14E because it's going to ease product testing and compliance. Then lastly, clause 15, which intends to amend section 33 of the Principal Act. We propose that we retain the list of prohibited smoking areas as is currently contained in section 33 of the Act, and instead delete or remove designated smoking areas. So of the current section 33 of the Act, the only change we are proposing is the removal of the designated smoking areas, but the list of prohibited smoking areas as per section 33 of the current Act be retained. And with those remarks, thank you very much. I submit.
Thank you very much.
Thank you, Chair. I'm Tommy John from the National Taxpayers Association. Much has been already highlighted. I'll just like to emphasize on Section 12 of the Principal Act Amendment in terms of progressive taxation of these products based on the volume of nicotine concentration. So for us, we probably have the latest study on ends and ends in Kenya. We did a landscape study, and it came out clear that one of the challenges that our tax enforcement authority faces is the number of tires in terms of taxing these products. And therefore we support amendment to, instead of having this progressive taxation based on nicotine concentration, we should have a uniform system of taxing. On flavor, we also suggest that we ban flavors, because again, flavor has been used to entice young users of these products as well as women. Therefore, we support the rest of the proposals as made through our memorandum.
Help me understand, how has it been used to entice women?
So,
It's not applicable to men.
So through this study that we did, we realized that, so based on our societal structure, for the longest it was perceived that men were the ones who were able to smoke and come out publicly even to smoke and agree to be using these products. So in order to onboard youths and women, we got products that are flavored. For instance, if I use a tropical flavored product and I pass close to you or any other person, you might not be able to tell. Either you'll confuse it as a perfume or a mouth freshener. And therefore it is easier to conceal and you are able to use. And even in some of our schools, because I interact with students at university level and even in our studies, those are some of the issues that we were able to find out in our findings.
Thank you very much.
We're here to stand on public health. As you well know, in our country, non-communicable diseases account for 41% of all deaths, more than 50% of hospital admissions. Tobacco and nicotine products are a leading cause of cardiovascular disease. There is research which has been conducted to show the role of nicotine in causing cardiovascular disease, which is a leading non-communicable disease in our country. So essentially, we are here to stand on regulation and banning of nicotine products, specifically banning of these nicotine products, which are being marketed to children, to young people. They are being used in schools because, as my colleague has said, they do not have because of their flavors, they are attractive to the young people. They are being used in schools. They are difficult to detect. So we're here to stand on banning of these products because they are a health hazard. We talk about tobacco as a revenue stream. Do you ever consider the amount of money the government is spending in terms of healthcare, in terms of managing renal disease, which was the biggest cost center for NHIF? The multiple number of people who are renal dialysis because of cardiovascular disease, diabetes, which is also an end product of tobacco use, as well as many other non-communicable diseases. So let us not be fooled by the industry and tobacco industry, selling their poison to our children, hooking them on nicotine. Nicotine is the addictive substance in tobacco. So for those who don't know, these nicotine products are just an efficient way of delivering nicotine into your system and hooking you onto nicotine. So we should ban these products. That is my submission, and I support my colleagues from KENCA. I also support the Ministry of Health in terms of expanding the definition of tobacco products to include these harm-causing agents, which are being marketed as less harmful to our children. This is not right. And this really, there is scientific evidence. You're looking at me. I have read the scientific evidence. I happen to be a pharmacist by trade.
Sorry, you cannot look at the chair and ignore it.
Sorry, Mr. Chair. Yes, but I just qualified. I am qualified to speak on this topic. I have a PhD in medicinal chemistry, which is actually the chemistry of drugs. The way that drugs interact in the body, the way they interact with receptors. You're now producing nicotine, which is going to interact with the nicotine receptors in our body to cause stimulation, to increase your heart rate, to increase your blood pressure. So basically what we're doing is we're injecting poison and we are inhaling poison. We are imbibing poison through our mouths by the buccal absorption of nicotine, a very efficient absorption service for drugs in our body. So seriously, we need to think seriously about these nicotine products, and I really commend the honourable member who has introduced this bill. We need to wake up and understand what is happening in our country, the hooking of our children onto nicotine, which will then progress into other substances of abuse. And I submit. Thank you.